we've been having patient satisfaction surveys for a number of years as part of the quality and outcomes framework in general practice, and we found out, since its inception, that we, as a PCT area, weren't doing too well. It was a difficult area because seeing patients and customers was a kind of change in culture that we had to sort of go through. And we needed evidence to prove to ourselves that it was required. So what we did on the basis of these adverse patient satisfaction surveys, took up an offer from the PCT for some training in patient experience. We were sort of being judged on 3 or 4 fronts. Well, the first one was the general cleanliness of the surgery. Second was the face-to-face contact with receptionists. Then the telephone contacts, and finally the mystery shoppers who were going as far as booking an appointment and then obviously just withdrawing. And so each of the practices had their own sort of survey or audit. Each at the end was given a CD of their findings. They actually worked on that in their practice. And then we went on to have a whole group meeting where we discussed all the issues, worked up solutions, came up with standard responses for receptionists. And then finally what we did was we agreed with the PCT that we would set our own standards and then be judged by them as well. The whole intention was that if we did this as a group, that we could say to patients that if you went into an ICOF practice, and we all had sort of badges made, that you would get a standard of service. And we also agreed as a group of GPs that we will actually keep our focus on this and make sure that we're doing some form of revision training annually, because it's as important as every other thing that we do